Hi, my name is Marie Gosselin. I'm an endodontist practicing in Quebec City, Canada for the last 8 years. The past few years have been rich in development of new mechanical file systems. As new systems reach our offices, confusion among dentists rises as to what system to use on a daily basis. Today, I will talk to you about my clinical experience in my practice and the choice of file system I use relating to the situation I encounter. The WaveOne. When WaveOne was first presented to me, what drew my attention to it was simplicity of canal instrumentation, but also simplicity for the practice in a clinical setting, meaning ease of file management being a single-use file. An endodontic procedure is a complex treatment, and each step must be performed properly starting from diagnosis to canal obturation. Missing one of those steps will most likely lead to failure. Having said this, a one-file, single-use with safe canal shaping and reproducible technique, all these advantages made me want to learn more. After reviewing literature and using the files, I adopted them in my practice. The WaveOne is a file that works by making a reciprocating movement that is not equidistant, meaning the rotation on one side is different than on the other side. In the case of the WaveOne, the file will engage in a counterclockwise motion 5 times more than its clockwise motion. The angles chosen for the reciprocating action have been extensively studied, so that the cutting engaging of the file will be reversed and disengaging is done right before the file reaches its fracture limit. To satisfy my scientific curiosity, looking at the literature on the reciprocating motion, I found the following: that with one file system, we can remove the endotoxins and bacteria as efficiently as with multiple files. We can also obtain canal shaping that is centered on the original shape of the canal, thus limiting the chances of lateral and apical perforation. In a clinical setting, the feeling is very different than with conventional files. One can have the feeling of having a small jack drill in your hands. Here are some images of the instrumentation with the WaveOne. Like with all other files, a straight line access is required. This will allow us to locate the MB2 and the other canals. A small round burr can be used to facilitate the access of the canals. Once this is achieved, a number 10 hand file is inserted into the canal until resistance is met. In order to remove dentinal triangles at the canal orifices, the coronal constriction, and to relocate the canal away from the furcation, the SX files can be used 1 or 2 millimeters short of the previous number 10 file used. The working length is then established using a number 10 or a number 15 file. This file can be bent with a sharper curvature in its apical portion to locate the apex and follow the natural canal path. In order to establish the glide path, meaning the natural path of the canal to the apex, the ProGlider can be used at this step. Personally, I find this file very useful for teeth with long roots or with pronounced curves. For the WaveOne instrumentation, a different tooth was selected and the preceding steps were already done. Rubber dam isolation was done with ORSeal to ensure a leak-free environment. The WaveOne is inserted into the canal, taking it until you feel that the file is not progressing anymore, or less effectively. The file is then removed, cleaned with a 2x2, and the canal is well irrigated. This sequence is repeated, the file cleaned and canal irrigated. It will normally take 3 to 4 insertions before the file can reach the apex, and sometimes more when the canals are longer or skinnier. As with any file, it's important not to push on the file in order to prevent pushing debris toward the apex of the canal, possibly then leading to a separation of the instrument. Once the shaping is done, it is important to ensure that the WaveOne primary has efficiently cleaned the apical portion of the canal and that the size of the file is appropriate for the canal. If this is not the case, then the WaveOne large file may be required. The apical gauging is performed by inserting a hand file number 25 at the working length, and if the file does not go beyond the working length, after applying a small pressure, the shaping of the canal is completed. We're now going to present some cases we did with the WaveOne. The first case is the first one I did with the WaveOne. It was a tooth with an irreversible pulpitis and a symptomatic periapical periodontitis. The access was kept conservative and we were able to achieve a very good obturation of the canals. The second one was a lower incisor presenting with a necrotic pulp and a symptomatic periodontitis. Even with the apical curvature, we could achieve a very good cleaning and shaping and obturation of the tooth. I've given you an overview of my approach when I use WaveOne. In closing, I would like to mention that I had the privilege to try out the new WaveOne Gold, and I think that they solve many points with the current WaveOne. The same benefits of the unique use of the reciprocating movement remain, but to this is added several enhancements. The WaveOne Gold, as its name says, is made with an alloy gold, a technological advance in metallurgy of third generation, providing the file a better flexibility, greater safety, better resistance to cyclic fatigue, cutting efficiency. For certain cases, the WaveOne might have seemed a bit stiff. The WaveOne Gold primary file maximum fluted diameter is now smaller, making it a file which works in the thin and curved canals more easily and effectively without removing too much tooth structure at the coronal third. When I tried the new WaveOne Gold, I thought that the elimination of debris was improved and the file more efficient, which might be a result of its new rectangular cross-section. Here's the tooth we picked to instrument with the WaveOne Gold. It's a tooth that has a pulpal diagnosis of a necrotic pulp and a periodicular diagnosis of a chronic abscess. As you can see on the image, we had some suppuration at the furcation level of the tooth. So we took a CBCT image of this tooth, and not only we had radiolucencies at the apex, but we also had a radiolucency around the furcation on the mesial root. So we started instrumenting the tooth, cleaning the tooth. The WaveOne Gold was, going very well. So we did irrigate the tooth, did our cleaning and shaping as we usually do, and then we obturated the tooth with a warm vertical technique. And as you can see, we were able to obturate a lateral canal on the mesial root, which should, bring us to have a complete resolution of the radiolucency in the infection on this tooth. So we have a really nice obturation. The canals have a really great shape. So the instrumentation with the WaveOne Gold went pretty well. We're really happy with this case. So hopefully all our cases with the WaveOne Gold are going to be like that.